first step is to gather all necessary supplies and equipment. For this skill, you will need at least 2 sterile gown packs and sterile gloves in the appropriate sizes for the surgeon and yourself. Make sure you get enough of each size in case of contamination. Before any item can be opened, it must be checked thoroughly to make sure the integrity of the package has not been damaged in any way. Open the outer wrapper and place the inner gown package on the Mayo stand. Open the gown using the basic principles of aseptic technique. You will also need to check the integrity of the glove package and verify that the package is sterile unless the integrity of the package has been compromised, as according to event-related sterility. Open the gloves onto the Mayo stand using sterile technique. If you are wearing gloves of different sizes, make sure the larger size is opened last. The surgeon's gloves are to be opened onto the back table. As you can see, the second pair extends the length of the table and is not appropriate for use. Additional gloves will need to be opened, sometimes more than once. Just before scrubbing, you will need to put on your goggles as according to standard precautions. Make sure the lenses are clean and free of debris. Now it is time to scrub. You will want to open the scrub brush package before wetting your hands. The surgical scrub starts with medical hand washing. Make sure you have a hospital-approved antiseptic for use. Check your hands and arms for cuts, abrasions, and for any other open wounds. If an open sore or cut is present, it can harbor bacteria and may place the patient at a higher risk for surgical site infection. You will need to check with your supervisor to obtain permission to continue with the scrubbing process. Open the scrub package and place it on the back of the sink. Turn on the water and adjust the temperature. Thoroughly wet your arms and hands and squirt or pump a moderate amount of soap into the palm of one hand. Vigorously rub your hands together to obtain a lather. At this point, the hands are held in the down position as according to the principles of medical hand washing. Continue washing the hands and 2 inches above the wrist for a minimum of 30 seconds. Pay close attention to the area between the fingers. Rinse the hands and wrist of all visible soap with the hands in the down position to allow the water to flow from wrist to fingertips. Obtain the nail cleaner from the scrub package and clean under each nail under running water, holding the hands with fingertips extended in the upright position. From this point forward, the hands must always be held higher than the elbows. After all nails have been cleaned on both hands, the nail cleaner can be discarded. Reach inside the scrub package and remove the scrub brush. Wet the brush and squeeze it until a lather is visible. To ensure there is enough soap present when scrubbing the nails, squeeze the brush over the tips of the fingers. Scrub the tips of the fingers 30 strokes with the brush side of the brush. One stroke consists of one up and one down motion. Visualize your thumb and fingers in planes of 4. Each plane is scrubbed for 10 strokes. The hand is divided into 4 planes: the palm, the back of the hand, and each side. Each plane is scrubbed for 10 strokes in a circular motion. Rinse the brush and squeeze for lather. At this point, you use the sponge side. Divide the arm into 3 sections with 4 planes in each section. Scrub 10 strokes for each plane, beginning at the wrist area. Pay close attention to the position of the hands in relation to the elbows. The hands must be maintained higher than the elbows at all times. Also, watch closely to make sure your fingers, hands, or arms do not come in contact with any possible source of contamination. Repeat these steps and scrub the 4 planes of the middle section 10 strokes each. The upper section, which includes 2 inches above the elbow, will be scrubbed next. Scrub all 4 planes 10 strokes each. Rinse the brush and then transfer the brush to the opposite hand. Repeat all steps on opposite fingers, hand, and arm. Discard the scrub brush and rinse each arm by passing the first hand and then the arm under running water. Keep the elbows bent to maintain the hands in the upright position. Do not move the arms back and forth through the water, and pay close attention to avoid making contact with any part of the sink. Turn off the water and allow the excess water to drip into the sink. Proceed to the operating room with elbows bent and hands held between mid-chest to waist level. Enter the room by pushing the door open with your back. After entering, proceed to the opened gown and gloves. Remove the towel by pinching and lifting up and away from the sterile field. Be quick. Do not allow water to drip from your hands onto the gown or gloves. Take one step back from the sterile field. Hold the towel and let it unfold. Lightly grasp the opposite corner and pull the towel open. Bend forward slightly at the waist so that the towel does not come in contact with the scrub suit. While holding the end of the towel in the palm of your hand, begin drying the opposite hand using a blotting motion. Dry circumferentially from the fingertips to 2 inches above the elbows. Transfer the towel to the opposite hand by grasping the unused end. Blot from fingertips to elbows on second hand and arm. After drying, drop the towel into a receptacle from waist level. Do not transfer the towel from one hand to the other.